The human papillomavirus, otherwise known as HPV, poses an epidemic similar to no other. As the most common sexually transmitted infection in the United States, HPV is found in over 79 million Americans. About $4 billion are spent annually on treatment of HPV infections. This exceeds the economic burden of any other sexually transmitted infection except HIV. Symptoms include genital warts and the development of various cancers, including cancer of the cervix or genital area. So I hope to puzzle you with this. If the human papillomavirus is so prevalent, so pricey, so potentially dangerous, and so preventable, why has HPV not been solved? What can we do to protect ourselves and our communities from the spread of HPV? The papillomavirus is a double-stranded DNA virus that typically affects the epithelium and is highly specific to human species, hence the name human papillomavirus. The virus is very diverse. Over 40 different forms of the virus have been recorded, each with varying symptoms and levels of harmfulness. Many forms of HPV do not have any noticeable symptoms. In most cases, HPV is killed without causing any health complications. However, sometimes infected persons can develop serious symptoms and conditions. And to complicate this even more, these symptoms can be manifested days, months, years, even decades after a person is infected with the virus. However, we typically divide detectable HPV virus types into two categories: low-risk HPV and high-risk HPV. Infection with a low-risk form such as type 6 or type 11 is considered less dangerous. Usually, low-risk HPV types are associated with genital warts, benign cervical cancer abnormalities, and laryngeal papillomas. Genital warts in particular are considered very prevalent in the sexually active population. On average, 1 in every 100 sexually active Americans and 1 in 10 sexually active Scandinavians has genital warts, with most of these cases found in people between the ages of 18 and 24 years old. High-risk HPV types act as carcinogens in the development of cervical cancer and other anogenital cancers. HPV is most strongly linked to the development of cervical cancer, with the HPV virus found in over 99% of cervical cancer patients. The next big question is, how is HPV transmitted? HPV is spread through skin-to-skin contact with an infected individual, typically but not always during oral, anal, or vaginal sexual intercourse. As previously mentioned, over 79 million people, or 26% of the population in the United States, are currently infected with HPV. The virus is so common that approximately 80% of the sexually active population will have HPV at some point in their lives. Additionally, over 11,000 women develop cervical cancer annually, with over 3,000 deaths attributed to cervical cancer. The most notable demographic of patients with HPV infections, besides gender, is age. Up to 75% of new HPV infections occur amongst 15 to 24-year-olds, with prevalence among adolescent girls around 64%. Yet despite the high prevalence of the virus, there are many preventative measures that have been implemented over the course of the last decade. Most notably, in 2006, the Food and Drug Administration had approved the first vaccine against HPV, Gardasil, and recommended it to all females between the ages of 9 and 26. In 2011, the Food and Drug Administration had extended the recommendation of the vaccine to males between the ages of 10 and 12 to protect against genital warts. The available scientific evidence shows that HPV vaccines are safe and effective, and that the current recommendation will result in the best opportunity to prevent HPV infection and its consequences. To further minimize the risk of HPV, abstinence and monogamy with an uninfected partner are considered the most reliable strategies. For females, Pap tests are considered key to preventing cervical cancer. Most deaths from cervical cancer can be prevented through detection of precancerous changes within the cervix. The American Cancer Society recommends that all women should have a Pap test for cervical cancer screening within 3 years of beginning sexual activity, or by age 21, whichever occurs first. By taking all of these precautionary measures and adopting them on a national and global scale, there is no doubt that the HPV epidemic can be highly controlled and minimized. Research continues to advance our understanding of how exactly the virus works and why it is so communicable and diverse. Once again, my name is Diviya Rajesh, and thank you for joining the global movement against infectious disease.